Hello and welcome. My name is Tina Francois Blue, and I'm the Associate Director of Community Health Initiatives and Research for the Metropolitan Chicago Breast Cancer Task Force. The task force is a nonprofit dedicating to eliminating disparities in breast cancer outcomes for women across the Chicagoland area. We have a great show for you today. My guest, Kathy Walagora with EverThrive, formerly Illinois Maternal and Child Health Coalition. We're going to talk to you today about some really important information regarding the Affordable Care Act and information that you need to know in order to make an informed decision. So I just want to give you some brief information. Remind you, this is a live program. If you would like to call in, call 312-738-1060. Again, if you would like to information about the task force, you can find us at 300 South Ashland Avenue, Suite 202, Chicago. Our phone number is 312-942-3368. Our website, chicagobreastcancer.org. And you can find us on Facebook, Twitter, and Instagram. So, just going to dive in. So, Kathy, I know you've been, a lot of your career is focused in, and with your work with EverThrive is focused in policy. Can you tell us a little bit about yourself and about EverThrive?
Yeah, thank you. My name is Kathy Walagora. I'm the Director of the Health Reform Initiative at EverThrive, Illinois. EverThrive is a maternal and child health advocacy organization working to advance policies, support communities, and otherwise engage in activities that improve the health of women, children, and families across the state of Illinois. So we're based here in Chicago, but our staff are all over the place. We've worked from our founding to improve upon and expand access to Medicaid specifically, which provides access to health care for over 3 million people in Illinois from the founding. We're also one of the lead organizations that's worked over the last 7 years to implement the Affordable Care Act, or Obamacare, or the ACA, whatever you know it as,
Whichever one you call it.
here in Illinois. And we are now one of the organizations who founded a coalition called Protect Our Care Illinois. Protect Our Care is a coalition of healthcare advocates, healthcare providers, patients, workers, and others across the state who are committed to defending the Affordable Care Act, to protecting Medicaid from disastrous cuts, and in expanding access to high-quality, affordable health care.
Here's some information about Protect Our Care Illinois if you're interested.
And you can find us on our website, protectourcareil.org. We're also on Facebook and Twitter, which is the best way to get updates on the news and the activities that we're involved in, which are many right now.
Yes, we're all very, very busy right now. So just to take everybody back, and I think to kind of get us to a common ground, can you tell us a little bit about how the ACA has worked in Illinois? What has been the impact, and what are kind of the significant changes that have been implemented through the Affordable Care Act over the past few years?
Yes. So thinking back 7 years ago, Thursday is 7 years from when the Affordable Care Act was signed into law. In the United States, over 20 million people have gained high-quality, affordable health insurance that did not have it before. Health insurance, of course, is important for providing access to a doctor and the kind of care that you need, but it's also critical for protecting your financial health, right?
Absolutely.
For making sure that you don't file bankruptcy or experience severe.
If you are diagnosed with a chronic condition or a condition like breast cancer.
Yes. So the ACA has provided health insurance access for over 20 million people, including more than 1 million here in Illinois. 650,000 people in Illinois have gained coverage through the expansion of Medicaid to cover a large segment of our adult population. Additionally, over 300,000 people have gained coverage through the health insurance marketplace, so private health insurance plans. 75% of those people received financial assistance in order to purchase that plan. $700 million for individuals in Illinois and families in Illinois to help them pay their premiums every month. And of course, people have gotten covered through their employer, through their parents, through their spouse that didn't have access before.
So the young adults up until 26.
Young adults until 26 is a great example. Additionally, health insurance coverage has improved for everyone. The Affordable Care Act guarantees that certain benefits will be covered by your health insurance all the time. So this includes things like prescription drug coverage, preventive health services, cancer screenings.
Exactly. Mammograms are very important. So
Yes.
yes, we definitely have seen an increase in women actually going to get their screenings because now that they have either through Medicaid or through the exchange, they have the ability to do so at no cost.
Right. People also have access to mental health care.
Absolutely.
When we think about the substance use disorder part of that,
Yeah.
the opioid crisis, it's really important. Children's dental and vision benefits are guaranteed. Really important for keeping kids in school and healthy and happy
Yeah.
and ready to contribute as adults. The ACA is also guaranteed for all of us that our health insurance will be there when we need it the most.
Absolutely.
By eliminating the practice of imposing lifetime or annual caps on how much care your insurance company would pay for. And finally, the ACA has brought untold economic benefit to the state. It has created jobs in the healthcare sector. It has made it easier for people to actually be able to be fruitful, productive members of our economy. More importantly, two-thirds of the total federal revenue that comes to the state of Illinois comes from Medicaid reimbursement.
Wow. Yep. That's huge. So can you share with me a little bit about this current proposal from the House Republicans, the American Health Care Act? So what are the changes that it's proposing to make to the Affordable Care Act?
Yeah, so what is the plan
What's
we
the
hear so much
change?
about
Right.
do? What it does is it leaves 24 million people without health insurance, reduces the quality of health insurance for all of us, no matter where you get your health insurance, and it gives a huge tax break to the top 1% and huge corporations. And how does it do that? So it does that by eliminating the financial assistance that so many families need in order to pay premiums for their health
premiums,
insurance.
okay.
It permanently and devastatingly cuts Medicaid while changing the very premise of the program by shifting to what we call a per capita cap, which just means right now the state and the federal government work together to provide health insurance to
Okay.
the people who need it the most. And under this system, the federal government just gives states some money and they say, you figure it out, and leave states with the bill, whatever that bill might be.
So essentially, just to make sure that our audience, those watching, they understand kind of the gravity of that, essentially anybody who could not afford, who kind of met that Medicaid eligibility, essentially they were guaranteed the ability to access care. So they automatically had a foundation of care for those who needed it.
Yes.
Basically.
Yes.
And so now with this per capita cap, essentially that wouldn't be there. There's no kind of guarantee that if
Yes.
you absolutely needed it, you would be able to access care
Yes.
in any form.
Yes, and when in the state of Illinois, more than half of all kids are enrolled in Medicaid. So when we think about what that means, if we are no longer guaranteed health coverage for our kids, for kids from low and middle income, hardworking families, it can be a real problem. More importantly, if there's a public health crisis, so in the South they're dealing with Zika, if we have that kind of problem in here in Illinois, under this, the state of Illinois would have to fill in the additional costs caused by that public health crisis in order to meet the need of our residents. The other thing that this law does is it eliminates the taxes enacted in the ACA, which means it's going to be a lot harder for us to go back if things should change and actually fix this, because the money to make it happen is gone. And the money to support what they can't repeal, what Republicans can't repeal in the process that they're using, won't be there. So it puts everything else on the table. So when you hear, oh, the plan doesn't take 26-year-olds out of their parents' health insurance, or the plan still ensures that people with pre-existing conditions can get covered, that's not guaranteed if the money to make that possible is gone.
Exactly. So, I mean, we can still have a component of the law in place, but we have not actually provided the dollars in order to implement
Right.
policy.
Right.
So basically, it's defunct legislation,
Yeah.
just to be frank.
It's there in name only. And of course, that's the repeal part. We always hear about the replacement.
Right.
So this bill does have what they call replacement provisions that are wholly inadequate for meeting the healthcare need here in Illinois and across the country. The law has things like, or the bill has things like age-based tax credits that don't respond to the actual cost of health insurance
Okay.
and provide the same assistance to billionaires. Bill Gates gets the same amount of financial assistance under this plan as a low-income senior and more than a low-income young adult. Seniors are hit especially hard because the bill allows seniors to be charged 5 times more in their premiums than young adults, but only provides double the financial assistance.
I mean, do you know have they released rationale behind, why they would allow that to happen?
seniors, they say, experience more healthcare costs.
And so
their premium should reflect that. But of course, seniors also could have a harder time paying those costs. And actually, the Congressional Budget Office, the nonpartisan Congressional Budget Office, indicates that this scheme of increasing the price by five times but only doubling the subsidy actually increases the actual financial liability, the financial risk for a middle income senior by 750%.
So essentially, the progress that we've made with respect to people being able to afford their care and removing the likelihood of bankruptcy and families having to file for divorce because they're trying to protect certain assets because again, just the sheer cost of their medical care. Instead of continuing to move forward with that progress that we're made, actually we're going backwards.
Yeah. And also the replacement provisions include and rely on failed ideas, things we've tried before that didn't work, like health savings accounts, which provide some relief to high-income people who have money to save. But for lower-income people who don't have money to save, health savings accounts just increase the amount of money you may have to spend to actually access health care. They also rely on things like high-risk pools, which we had here in Illinois. And in a high-risk pool, what we were supposed to do was provide health insurance to people who couldn't get insurance otherwise because they were sick, people with cancer, people with catastrophic, devastating illnesses that insurance companies turned away. This bill brings those back. Even though it left so many people in Illinois without health insurance, it left people with we had huge waiting lists, the premiums were 150% higher or more, and we had lifetime caps on what our high-risk pool would actually cover.
And can you take us just a quick second and remind everyone what is a lifetime cap?
A lifetime cap is a cap from your insurance provider, a dollar amount that they will pay out for your healthcare services. So for many people, a lifetime cap would be $5 million. For many of us, we're going to be really lucky not to reach that cap. But for people with cancer, for people living with HIV and AIDS, for babies born prematurely, you can reach that cap very quickly. And so essentially,
once they've met that lifetime cap, then under that existing plan, there's
no
more
covered.
care.
Yes.
And then with a pre-existing condition, you may not be eligible to get care under another insurer.
Yes. Correct.
So you truly are at a loss.
Yes.
So just take a quick second. I just want to remind you guys that we're live right now. Please give us a call if you have some questions, you want to engage in this dialogue. Again, you have really important information that you want to specifically ask Kathy to understand how this may impact you directly. Give us a call at 312-738-1060. So Kathy, how will these changes affect Illinois directly, especially given our current state of our budget?
So this bill, there's no other way to say it, is a punch in the gut to states, to all of our states. The impact cannot be stated enough. It's devastating. In a state like Illinois, where we're experiencing the worst budget crisis any state has ever experienced, it's even worse. Illinois is really going to fare worse, suffer more than many states. As I said before, more than half of all of our children, 3 million people total in Illinois, are enrolled in Medicaid. Most of those people are working or in working families.
Right.
And cutting any Medicaid cut would send us into a tailspin. The proposed bill is a 30% cut to Medicaid funding over 10 years. We cannot recover from that. This is a permanent and devastating change.
And so essentially Illinois would have to figure out an additional pot of money to be able to subsidize those
We would have to figure out an additional pot of money, or more likely, we would cut eligibility, cut services, cut the rates that we pay our doctors. The impact of the Medicaid changes, but also the changes to private health insurance, has an economic impact. So the Commonwealth Institute earlier this year did an analysis, and what they found is a $2 billion loss in tax revenue to the state of Illinois. Just for us, $2 billion lost. $113.8 billion in economic output. So the actual money that businesses in Illinois generate is reduced. And just in the healthcare sector alone, a loss of 114,000 jobs here in Illinois. So it has an impact beyond our healthcare to our actual financial well-being.
Absolutely.
This also leaves millions without health insurance. As I said before, 24 million people are expected to become uninsured under this plan. We have an amendment that came out today. We won't know the impact of that amendment before the bill is called for a vote, but anybody who looks at it can tell this would actually leave more people uninsured. So 24 is our low estimate of the number of people who lose coverage under this plan. More than 1 million people here in Illinois are going to lose coverage as a result of this. Additionally, premiums are going to increase. Premiums are going to increase for a number of reasons. We expect, and this comes from the Congressional Budget Office, that premiums next year will go up 15 to 20%, and premiums the year after that will go up 15 to 20% at least. This is not just for the individual market. This is people will get coverage to their employer. So all of us are impacted. We're going to see our costs go up. At the same time, your insurance company will be expected to actually cover a lower percentage of your healthcare costs.
So you're paying more for less.
So you're going to pay more for your care. You're going to have less care, and you're going to have your premiums increase as well.
Because this actually does not include maintaining those minimum coverages, correct?
So it goes back and forth. So the Affordable Care Act has 10 categories that must be covered. This bill can't get rid of that because the leaders in Congress are using budget process. So they can't deal with that specifically. But what they can do is deal with this super insurance wonky thing called actuarial value, which is literally the percentage of healthcare costs that a health plan is going to cover. Under the Affordable Care Act, that actuarial value is quite high. Under this plan, they bring it down. So you'll actually see that your insurance plans are covering less of your actual care. And then as I mentioned before, when you remove the funding mechanism, even though those categories of coverage don't come out right away, we could expect to see those change very quickly.
Absolutely.
The reality is this. I spend a lot of time talking to folks. I've worked on this for the better part of 7 years now, and I've talked to literally thousands of people across the state. I support our enrollment assisters, so I hear what people say when they're actually enrolling in health insurance, and I hear what they say if they don't end up enrolling in health insurance. And one of the things that we have to recognize is not everything was working. There are still people who are uninsured. There are still people who are unhappy with their health insurance. This bill does not address those challenges.
Absolutely.
We want people to like their health insurance. We want health insurance to be affordable, and this bill does not respond to what people actually want. People want to be able to see their doctor. They want to have lower premiums and lower cost sharing, and this bill is going to make all of that more difficult. Instead, this bill is responding to an unidentified problem, increases the number of people who don't have health insurance, and it increases costs for all of us.
And I think just to kind of share the task force experience over the past few years, once ACA was implemented, we, prior to that, the task force, we began a navigation program where we were actually supporting women who were uninsured through the process of actually connecting to donated mammograms. So it just really supports screening and helping to eliminate the disparity in breast cancer outcomes because women did not have access to quality breast health care. And I can absolutely say, because of the ACA, we were able to shift our client population from approximately about 90% who were uninsured, 10% who had Medicaid. We had shifted to 50-50. So our conversations were not just about, let me help you access a free service. It was now, you have health insurance. So let's talk about your health literacy. Let's talk about you understanding what this is and how you can access care. So many women and so many people actually did want to begin to engage and establish a medical home and have a provider. And it's so unfortunate that the progress in the task force, again, is just one organization. We've reduced the disparity by 35%. And so we actually have seen a significant decrease in breast cancer outcomes, or breast cancer mortality specifically, in the past between 2008 to 2013. We're absolutely going to see a reverse of all of that. And again, breast cancer is just one outcome. So I just want to ask you now, what's happening this week and how can people get involved?
Yeah, this is a big week.
Busy week, yes.
So as we mentioned earlier, Thursday is the 7th anniversary of the signing of the Affordable Care Act. It's also the day we're going to see the House vote to repeal part of the Affordable Care Act. And this comes after a really crazy process. So many people were shocked 2 weeks ago. It was totally unprecedented. The House bill, which had been kept secret, was literally hid in a room in the basement in the Capitol, so only Republicans could read it before debate. This bill was pushed into committee, and a committee vote was forced, even though we didn't have at the time analysis on how much it would cost, on how many people would lose insurance as a result. And that bill was approved in committee, fully on party lines. It's important to know how this is different from the Affordable Care Act, because people might remember 7 years ago a big hullabaloo about the Affordable Care Act being jammed through and forced down people's throats. So in contrast, in considering the Affordable Care Act in 2009 and 2010, the House held 79 hearings over the course of a year. They heard from 181 witnesses. They accepted 121 amendments. The Senate had over 100 hearings, roundtables, and other public forums to discuss the bill. And the Senate debated the Affordable Care Act for 25 consecutive session days.
Wow.
So they spent the better part of a month talking about this before they voted. Now, on
Clearly
Thursday,
you've had feedback.
Yes, yeah, and it shaped the way that the ACA looked, for better or worse.
Right.
So on Thursday, this coming Thursday, just 2 weeks after making the American Health Care Act language public, and less than 48 hours after making an amendment language public, Speaker Ryan has scheduled a full House vote for this plan. The time is now to urge House members to oppose this bill. And maybe we can put the sign back up. This is the final vote in the House, and it's not guaranteed that this succeeds. The House remains fractured, and passage of this bill is not guaranteed. So what do? You need to call your representative today. You need to call them tomorrow. You need to call them Thursday morning. And you need to demand that they vote no on the American Health Care Act. This is the number that you can use to do that.
866-426-2631. Again, that's 866-426-2631.
When you call, you should share your personal story. Demand a no vote, share your personal story, and be respectful but firm. Then tell your friends and your family, especially if they live in a Republican district, because unfortunately this is a fully partisan issue. Yeah. It doesn't have to be. Tell your friends and family who live in Republican districts, who live downstate or in Indiana or Wisconsin, to call their representatives and share their story. You can also support Protect Our Care Illinois. We are a statewide coalition working on this. You can get news and updates from our Facebook and our Twitter pages. You can go to our website to find links for all of that, and there's our website. It's protectourcareil.org. And you can find out about the news, you can get updates, you can also find out about actions that we're planning, and we have a lot of actions planned. So if you go to our website, if you go to our Facebook, you'll find tomorrow we're asking people across the state to go live on Facebook, do a Facebook Live video, tag your elected official, and speak directly to them about your concerns with this plan. Demand that they vote no.
Your voice counts.
We'll all do it together. We'll use hashtag #ILSaveACA. On Thursday, we have rallies planned at different offices around the state. We're going to bring balloons, and we're going to bring cake, and we're going to bring pennies, because copper is a 7th anniversary gift. And we're going to celebrate the 7 years that we've had the Affordable Care Act, and make sure that our representatives know that we will not accept their vote, their support of this bill.
Absolutely. And so just to let you know, if you guys want some more information about EverThrive and all of their initiatives, the task force also has very active advocacy initiative that's aligned with everything that EverThrive is doing as well. Please, you can reach us. You can actually email advocacy@chicagobreastcancer.org, or you can go to, again, chicagobreastcancer.org, go to our website and follow us that way. Follow us on Facebook, Twitter, and Instagram. Also, the task force, we have an advocacy day coming up. Go to advocacy, email advocacy@chicagobreastcancer.org. We're running out of time, and I just want to say thank you so much, Kathy. This has been a great conversation. We have a lot of really great information that has been shared. We appreciate your time, but we definitely want to let you know your voice matters. Regardless of, partisan, health is something that we all want to maintain. Everyone's family is important to them. That's something that we can all reach a commonality on. And so we need to make sure that we're all looking and paying attention to policy that is actually going to improve our quality of life, not detract from that. So again, I just want to say thank you, and any last thoughts that
I
you'd
would
like to
say
share?
when Congress moves these things quickly as they have, it's because they're afraid of you. So make your calls, post on social media, be heard, because they're trying to silence you.
Power in your voice. Thank you so much again. ChicagoBreastCancer.org. Please come to our website and follow all of the activities that are going on this week. Thank you so much.